welcome to another Facebook Live with MedStar Health. My name is Sarah Reinauer, and today I am joined by the Chief of Thoracic Surgery at MedStar Health's Angelos Center for Lung Diseases, Dr. Ziv Gamliel. And since November is Lung Cancer Awareness Month, today we are going to be discussing lung cancer risk, prevention, and why it's important to detect it early. If you'd like to learn more, then stick around, give us a like to let us know you're watching, and leave any questions you have in the comments below. And we also encourage you to share this broadcast with your friends. Dr. Gamliel, thank you for joining us. We really appreciate you being here today. Before we begin, could you tell the viewers a little bit about yourself and the work you do here at MedStar?
I'm a thoracic surgeon, which means I do surgery on the chest. I'm a non-cardiac thoracic surgeon, which means I do every operation in the chest that doesn't relate to the heart or the great vessels that come off it. And what that means is that most of what I do relates to tumors and masses in the chest, which are mostly cancerous, and the most common diagnosis that I work with is lung cancer.
Great, thank you. So let's get into the questions. First of all, what are the risk factors for lung cancer?
So the risk factors for lung cancer are very well known. We've known for decades now that cigarette smoking is by far the #1 cause of lung cancer, but it's not the only cause. Asbestos is a big contributor to your risk for lung cancer, and exposure to radiation, especially to radioactive radon gas that sometimes finds its way into our homes, especially into our basements, can be a risk factor. And then there may be some risk associated with genetics that is very poorly understood to this day.
So kind of going along with that, talking about genetics, are there people who are more at risk for lung cancer, just based on age or anything else?
So smoking is the #1 risk factor for lung cancer, and if we look at patients who get lung cancer, we can divide them into different groups: people who have never smoked, people who are currently smoking, or people who are former smokers. Lung cancer happens most frequently among former smokers because people who are former smokers, generally speaking, have a history of having smoked for a long time and then quit. Lung cancer doesn't develop the first day that you start smoking. It may take 20 or 30 years for a lung cancer to develop, and that is thought to be the reason why former smokers are really the most common group that we see developing lung cancer. We certainly see it in current smokers, and we even see it in lifelong non-smokers sometimes.
Okay. Well, thank you for explaining that. What are some of the warning signs of lung cancer that people should look out for before they come in to get looked at by a doctor?
So lung cancer does produce warning signs sometimes, and those warning signs might be the result of the cancer that is in the lung, or it might be the result of a cancer spreading from the lung to another area of the body. So we know that lung cancer likes to spread to the brain, it spreads to the bones, it spreads to the liver, and certainly if somebody develops a seizure for no good reason, it might be that they have a metastasis from their lung cancer to the brain. If somebody develops bone pain for no good reason, it may be that they have a metastasis from lung cancer in their bone. By the time you start to develop signs or symptoms like that, it's generally speaking not possible to cure your lung cancer. If there's a tumor inside your lung producing symptoms, it might cause shortness of breath. That's generally speaking also a late sign. That doesn't tend to happen very early on. You might notice a new wheeze that you never had before. If your lungs are making squeaky sounds for the first time ever, that's something that needs to get checked out. Certainly, you could cough up blood if you have cancer in your lung. But generally speaking, unlike some other cancers, lung cancer doesn't tend to cause any signs or symptoms until it's fairly far along. And so I don't recommend that anybody who's at risk of lung cancer wait until they develop any signs or symptoms of their cancer before getting it checked out.
Right.
The key is to not wait for signs or symptoms to develop, but to catch any lung cancer early before it has a chance to cause those things.
Yeah, which leads into my next question. How can lung cancer be prevented?
There's not really any great way to prevent lung cancer, but there are many ways that you can not put yourself at risk of getting lung cancer. And the most important way is to never be a smoker. And certainly, if you're a lifelong non-smoker, you're much less likely to contract lung cancer. If you are a smoker, smoking more is going to put you at greater risk of getting lung cancer, and smoking less is probably better than smoking more. So anybody who's currently smoking thinking that it's too late for them to benefit from quitting smoking is mistaken. Cut your losses and quit today. Avoid exposure to asbestos, to radioactive materials. That sort of smart lifestyle choice is going to minimize your risk of getting lung cancer. There's not any way that we can guarantee that someone won't get lung cancer, but I think that the majority of patients who get lung cancer have put themselves at risk by their behaviors or their occupations.
Right. So speaking of smoking, you know, a lot of people know the dangers of smoking cigarettes at this point, but something that's popular now is vaping. So let's talk about vaping for a second. First of all, what is the difference between vaping and smoking cigarettes?
So everybody's familiar with those old movies where cigarette smoking was glamorized and somebody pulls out a traditional cigarette and lights it with a cigarette lighter and inhales and puffs out some smoke. So you're setting tobacco leaves, dried tobacco leaves on fire, and you're deliberately inhaling the smoke from those burning tobacco leaves into your lungs. That's what traditional smoking is. And what makes it so appealing to smokers is that they develop an addiction to a substance called nicotine that they inhale into their lungs along with many, many other chemicals. And that nicotine is a strongly addictive chemical that keeps people coming back for more. With vaping, you don't have to set anything on fire. You use a liquid chemical and you inhale the vapor from that with an electronic device instead of setting something on fire. And that chemical that you're inhaling contains nicotine in order to keep you coming back for more. That's how the companies that sell these materials make money, is they get people hooked. The trouble is that even though nicotine itself is generally not harmful, there are so many other chemicals that you inhale into your lungs along with the nicotine, whether you're smoking traditional cigarettes or using an electronic cigarette or vaping. And those substances can be very harmful, not only causing heart disease or lung disease, but also putting you at risk of getting cancer.
And do cigarettes versus vapes, do they have different effects on your lungs that we can tell at this point, or is there not enough research on it so far to be able to talk on that?
Great question. You know, the Western world has been familiarized with cigarette smoking since Columbus brought cigarettes back from the New World to Europe. We don't really have that many years of experience with electronic cigarettes or vaping. And as we discussed a few minutes ago, the harmful effects of smoking often take decades to develop. We just haven't had enough time to see the full range of ill effects that people can expect to see as a result of their vaping. But we do know that cigarette smoking and vaping have in common numerous harmful substances that get inhaled into the lungs, and there's not really any reason to think that vaping is going to be harmless. We can expect that vaping is going to produce many or most of the same problems in the people who engage in that behavior as cigarette smoking would.
Okay. And, you know, vaping is pretty common now amongst a lot of younger people, college students, and even high schoolers. Is there more of a concern with them starting at a younger age? Like, would it have a different effect, or just, you know, starting at a younger age means you're probably going to do it longer?
So on the positive side, we're seeing that with every passing year, there are fewer cigarette smokers, and we've already begun to see that the number of lung cancer cases that we encounter is starting to decline year by year. That's a good thing. The thing is that the industries that provide these harmful materials to people want people to get hooked as early as possible, and even though cigarette smoking is falling out of fashion, vaping is really accessible to younger people because they don't need a cigarette lighter in order to set something on fire. They can easily hide it if they do it in their bedroom. They can hide it from their parents or family members. They can hide it more easily in school. And to make matters worse, all these companies that provide vape in order to get young people hooked on nicotine and keep them coming back for more product, are creating these vapes in a variety of flavors that are really designed to appeal to young people. And so what I would say is that nowadays our kids are all being entrapped by these companies that are exhibiting predatory behavior, trying to get our children hooked on nicotine, and really are mindless of all the ill effects that are going to fall upon our kids if they get hooked.
Right. And so, can it cause lung cancer, or is that still, undetermined at this point?
We don't really have official statistics to tell us what the risks are of vaping with lung cancer, but we know that vape contains dozens upon dozens of cancer-causing chemicals that are the same ones that are found in cigarettes. And so it's just a matter of time before we can say, no surprise there, vaping causes cancer in the same way that smoking does.
Right. Well, thank you for explaining all of that. I want to take a moment to just pause and say, if you're joining us now, thank you for tuning in. We are here speaking with the Chief of Thoracic Surgery at MedStar Health's Angelos Center for Lung Diseases, Dr. Ziv Gamliel, and we're talking about lung cancer risks, prevention, and the importance of detecting it early. We have more to talk about, so keep watching, share this video with your friends, and if you have any questions, leave them in the comments below. Speaking of comments, we got a lot of comments before the broadcast started. Lots of praise for you, so I was going to read a little bit of them. Arlene Klaproth said, he is the best. Betty Retman said he is our #1 lung cancer doctor. Donna Pittinger said, Dr. Gamliel is the best. He operated on me in February 2020. He is also very knowledgeable, skilled, and I have never met another physician or surgeon with such a great personality and bedside manner. Love and respect, Dr. G. Tina Bauer also said, Dr. Gamliel is my mother's doctor. I've never met anyone so kind and compassionate as Dr. Ziv. My mother felt so comfortable going to see him and actually looked forward to it. After 2 separate surgeries on each of her lungs, she is doing well so far and cancer-free. Can't thank him enough. So I just wanted to share those with you. You got a lot of fans.
It's really a blessing to be able to help people that are really in trouble when I meet them. And the good news is that there are many people who are fortunate enough to have their lung cancer detected early enough that they can be cured. And these people then continue to follow up with me indefinitely. And I develop relationships with these patients who are really dear to me. And it's really a privilege for me to be involved in their lives and get to know their family members and just see them live their lives productively and happily.
That's great. Well, we all appreciate you. We all appreciate you and all the work you do. So let's get back into the questions. You talked about this a little bit, but talk about it a little bit more. What steps can you take to find lung cancer early?
Lung cancer is a difficult cancer to find. It's not like you can do a monthly self-examination at home and find a lump in your lung, obviously. And so you could wait for signs or symptoms to develop, and as we discussed a few minutes ago, unfortunately that's most often going to end up finding the cancer too late. Really the time that we should be looking for lung cancer is when we have no way to feel it, no way to know that it's there, other than by examining ourselves on the inside with the help of imaging studies. So in the past, attempts were made to do early detection of lung cancer with chest x-rays, and the trouble is that chest x-rays were finding lung cancers, but only after they got to be very far along. So that means that the chest x-rays were detecting cancers typically at a stage where we couldn't cure them. CAT scans came along and were able to find much smaller nodules in lungs. They were able to detect cancer much earlier. The trouble is that in the early days of CAT scans, they required a lot of radiation exposure, and they were very expensive. What's happened over the last 30 years or so is that lung cancer has been easier than ever to detect because CAT scans are less expensive than ever, and they are now doable using much less radiation exposure than ever. So they're safer, they're cheaper, they're easier to come by, and really the burden of responsibility is on patients and their doctors to really make a decision to look for lung cancer. We certainly don't want to be searching for lung cancer where we're not likely to find it. Even though non-smokers can get lung cancer, they're not at particularly high risk. And so that seems to be maybe not the best utilization of resources and not the best utilization of patients' time and effort. But anybody who is at high risk of developing lung cancer from years of smoking or asbestos exposure should definitely make a plan with their healthcare provider to get screened on an annual basis, just in case this is the year that they come down with lung cancer. The technology is so good that we often find things that are really too small to know whether they're a problem or not, but then we can follow them closely, and if they start to exhibit bad behavior, if we see a tiny lung nodule that's growing, that is a sign that we really need to get on that.
And so speaking of that, what are the screening guidelines? Like, who would you recommend to come in and get one? Is there criteria they have to fit?
So let me begin by saying that the criteria for who should get screening for lung cancer, those criteria are changing. They are not getting more narrow, they're getting broader.
Okay.
So whatever the criteria are today, it is likely that in the future, lung cancer screening is going to be open to an even broader section of the population. But for now, we are looking at people between the ages of 55 and 75 or 80. And we're looking at people who have smoked for 30 pack years or more. And that means that we take the number of years of smoking, multiply it by the number of packs per day, and if we get a number greater than 30, that's somebody who should get screening. If they smoked a pack a day for 30 years, if they smoked 2 packs a day for 15 years, or some other combination that results in a number greater than 30, they should be screened. Anybody who has been a smoker in the last 15 years in particular, if you quit smoking many, many years ago, we're not yet certain where the cutoff should be. Should you get screening or not? If you quit 30 years ago, probably not. Currently the guidelines say if you quit less than 15 years ago, you should be screened. We're starting to see that even people who quit 20 years ago might need screening, but that data is forthcoming in the near future.
Okay, and if, you get your screening, comes back, you have lung cancer, what are the next steps after that? How is it treated?
Lung cancer screening is not necessarily going to tell you you do have lung cancer or you don't. Sometimes the results of screening are a little bit less clear than that.
Okay.
Typically what will happen is if you have any concerning finding, there's a high chance that you're going to get referred to a specialist in lung cancer, whether it's a pulmonologist or a thoracic surgeon or an oncologist. Somebody who will be able to tease apart the information that the CAT scan provided and then make a judgment as to whether something more is needed now or whether we should just check back in a few months.
Okay.
So when somebody has an abnormal finding, it might just mean that they get their next scan sooner than 1 year from now. Maybe in 6 months, maybe in 3 months. It might mean that they get a biopsy. It might mean that they get another test called a PET scan. There's different ways to sort of skin this onion and get to the bottom of things, but typically it's not like a pregnancy test where you find out I am pregnant or I'm not.
Right.
The real information that you get from lung cancer screening is there's something that needs to be checked on or we don't see anything bad for now.
So thank you for explaining that, clarifying that. So then what would be the next treatment steps if you do find out you have lung cancer?
When a patient arrives to see me in my office, we do a very thorough summary of their past medical history in order to determine what other health issues they may or may not have. And I examine them, we look at their scans together, and then we make a decision as to what additional information might be helpful. Sometimes that information concerns the findings on the CAT scan themselves, and that might mean that we send them for a nuclear scan called a PET scan. That PET scan is a nuclear medicine test where radioactive sugar is given to the patient intravenously. It circulates through their body. The patient lies under a camera, and the camera detects what areas of the body are glowing. some areas of the body normally gobble up a lot of the sugar and normally glow a lot. Your lungs tend to not glow very much. If anything lights up in your lungs, that's a sign of metabolic activity in that area of your lungs that shouldn't be there. Trouble is that might be due to cancer or it might be due to inflammation. Other areas of the body might light up in an abnormal way, and that might represent cancer or inflammation. So you need to interpret that scan with a certain level of experience and within the context of how the patient is presenting and their past medical history, of course. Sometimes, based on the findings, we might order a biopsy of something in the lung or something elsewhere in the body that is concerning. That biopsy may give us the answer as to what that is. It might be unsuccessful, in which case it might have to be reattempted, or we might have to come up with another plan. And often we end up testing the patients to see what their lung capacity is, how healthy is their heart, do they have any blood vessel disease that might make them a bad risk for lung surgery.
Okay, and so that, my next question is, are some treatments better than others? It sounds like that's more of a patient-to-patient basis, would you say?
There are a variety of treatments available for lung cancer. The big three treatments that we always consider are cutting it out with an operation, burning it with radiation, or poisoning it with chemotherapy. Sometimes we'll end up choosing one of those three methods. Sometimes we'll do a combination of two out of the three, and there are even cases where we use all three in combination. The best treatment for lung cancer is the treatment that is most appropriate for that particular patient. And what determines how appropriate a treatment is for a particular patient is how far along is their cancer and how fit are they to tolerate that particular treatment. And so really it's important to tailor a treatment plan for each and every individual patient.
Okay. Thank you for explaining that. Are there any new treatments available or soon to be available that you know of?
As a surgeon, I can speak about surgery with some degree of authority, but there are advances in radiation and advances in chemotherapy that I'm less expert to discuss. There are new developments all the time in lung cancer treatment. The main advances for my practice in surgery involve doing the same operation that we used to do with very large incisions, but now using very small incisions so that there's less injury to the patient that would be avoidable using the new technology. And also we are now finding out that there are specific scenarios where a patient has lung cancer that is a particular size in a particular location where we might be able to cure them with the same likelihood having removed less lung and preserving more lung for that patient. And that means that we are now able to cure people with less impact on their lifestyle, on their exercise tolerance, on their general fitness after surgery, so that lung cancer, if it's caught early, can now have less of an impact than ever on patients' subsequent lifestyle.
Great, that's great. We have a question from one of our viewers. Jackie Dempsey says, what do you recommend as the best methods for early detection screening in patients with no family history of lung cancer and non-smokers?
If you have no family history of lung cancer and you've never been a smoker, I think you should sit this out for now. And the reason is that, number one, you're at pretty low risk of getting lung cancer. Number two, there are absolute harms that can come upon people as a result of screening. They need to be exposed to radiation with their CAT scans at a regular interval, and they might end up getting procedures like biopsies or surgeries in order to remove things. If we do a biopsy on something that needs to be biopsied, well, that's an understandable risk, but sometimes we discover things with these screening CAT scans that aren't cancer. That would be called a false positive, and I think that if you have a low level of risk of developing lung cancer, you're probably going to have a higher chance of getting a false positive on these screening tests and going through diagnostic tests and procedures that you don't really need. So because lung cancer screening can harm somebody, we always need to weigh the risk of harm from screening against the risk of benefit from screening. Anybody who's at high risk of getting lung cancer because of years of smoking stands to benefit very greatly from screening and is very unlikely to be harmed. But if your risk of lung cancer is very low because you've never been a smoker, then lung screening is more likely to harm you than help you.
Right, that's important to know. Thank you for answering that. So what message, to wrap all this up, what's the message that you have for our viewers? What they should take away from this?
For those of you who are considering smoking or vaping, don't. Nothing good will come of it. So many harms can come upon you, not immediately, but down the road. It's just not worth seeking out an addiction in order to develop harm down the road. For those of you who have been smokers in the past or are currently smokers, it is a very tough habit to break. I think that there is help available for you for smoking cessation. Certainly you are at risk of getting lung cancer. Don't be afraid to look for that cancer. If you find that cancer early enough, which with lung cancer screening nowadays we can do, there is help for you that can get you back on track. It won't necessarily have to ruin your life. But don't neglect it because you aren't going to have the opportunity for curative treatment and preservation of your lifestyle indefinitely. At some point, if there's a cancer lurking in there, it is going to ruin your life, so don't delay. If you have the risk factors that meet today's criteria for lung screening, get yourself screened on an annual basis. I think that you stand to benefit greatly.
Right. Well, thank you so much. Wanted to give you one more praise that you got from a viewer. Desi Hutton said, Dr. Gamliel is a fantastic doctor. My husband Roger and I trust him completely. Thank you, doctor, for taking care of my husband. God bless you and your family. Just wanted to give you, end on a good note. One more comment of praise for you. So that wraps up our broadcast. Thank you so much, Dr. Gamliel, for joining us, and thank you to all of our viewers for tuning in and sharing your questions. For more information or to schedule an appointment, call 443-777-1133. Thanks for joining. We'll see you next time.